Hi, my name is Virginia Livingston, and this video is for WST 460, Women in the Body with Dr. Anastasia Todd. I've decided to discuss topics we've learned in class and how it relates to those with eating disorders. An overview of specifics that I wanted to cover were gender embodiment and cultural expectations, emotions, perception, language, and how it affects eating disorders and recovery, intersectionality and representation of those with eating disorders, and how neoliberalism and biopolitics affect and influence eating disorders. In order for me to discuss gender embodiment and eating disorders, I have to be completely transparent. There's not much information about eating disorders and how it affects others who do not identify as female. That being said, I think it's important to talk about how eating disorders can be influenced by ideas of femininity, masculinity, and how society thinks about gender being a strict binary. Judith Lorber and Patricia Yancey Martin talked about how masculinities and femininities are a social construct and how people perform their gender. Some people prescribe to gender roles that perpetuate a strict binary, but others do not. However, the way we act and how we come across are largely influenced by preconceived ideas, social and cultural biases, and the need to place people in specific categories. And these categories can enforce power structures and allow certain emotions and perceptions to be attached to those categories. And I viewed an article, and it was called The Feminology of Anorexia Nervosa and How It Intertwines with Gender and Embodiment. And it was an interesting article because it stated, although the study didn't find anorexic behavior to directly correlate with feminine gender role orientation, participants experienced traditional feminine gender role characteristics as negative, limiting, and devalued in society. And while women in the study had largely negative connotations to traditional female gender role characteristics, it was found that they actually valued masculine gender role characteristics because they were strong and they had control. And that really stood out to me as women internalizing cultural expectations on how to act and the appropriate way to produce a body for public consumption. Women are held to a high standard when it comes to outward appearance. There's an unsung obligation to be thin, happy, confident, feminine, whatever that is. And this is enforced through language and dialect with one another, the diet culture push, and the unwillingness to dismantle the gender binary. And we're being bombarded with messages that women have to subscribe to particular ideals while already being told that we're not enough as we are, and that femininity has to be a specific set of values. In the meantime, male characteristics are usually seen as strong, powerful, self-sufficient, and these are characteristics that many people with eating disorders feel that they lack. So it's no surprise that these are values that they wish to employ. An individual's perception of themselves can be molded by the experiences they have, especially in relation to one another. Perception can be influenced by dialogue and the emotions emitted from this dialogue. And perception is always embodied. People with eating disorders often talk about the feeling of being disgusted with their bodies. Their perception is that their bodies are worthy of that strong emotion of disgust. Sometimes those with eating disorders take their own feelings of disgust and project that onto others, and they perceive that others view their embodiment with disgust, and therefore that label persists with those who are suffering. And another part of this article about the phenomenology of anorexia nervosa discussed perception and dialect between doctors and patients with eating disorders. And the article mentioned the importance of choosing words carefully in order to not convey specific emotions one way or another as to influence the patient's experience. It also talked about allowing each patient to describe their experiences with their eating disorder and to not let any preconceived ideas, social biases, or own involvements to overshadow the dialogue at hand because it wasn't their story to tell. And I thought this was especially profound because it acknowledges how dialect, though with good intentions, can negatively assert the idea of absolute correctness in the medical profession because they're blinded by their own perceptions, their own knowledge, therefore ruling the patient's experience as other and can make the patient feel invalidated. Unwittingly, this creates a power structure between the doctor and the patient because one is seen as the standard while another experience, though completely valid, is being labeled as other. By allowing objectivity and discourse between doctors and patients, it allows people to see that eating disorders are not a one-size-fits-all situation. By not remaining impartial, it does a disservice to the patient and to the progress of treatment. And in regard to eating disorders, it's definitely overwhelming how little representation there is for people of color, men, LGBTQ individuals, disabled people, fat people, and older people. There's a huge lack of representation of people with bulimia nervosa, binge eating disorder, and EDNOS, eating disorders not otherwise specified. The stereotypical someone faced with an eating disorder is someone who's completely emaciated, which isn't always the case. And there's so little intersectional research done on this topic because of the false idea that eating disorders only affect thin, young, white, able-bodied women. Most people diagnosed and hospitalized for anorexia nervosa are female, and about 5 to 10 million adolescent girls and women are affected by eating disorders. But we don't get to hear about anybody else. And the incorrect narrative that only white women get eating disorders is incredibly damaging because both anorexia and bulimia are everly increasing in diverse populations of women. And unfortunately, because of that, the research is lacking. Society has a specific image of eating disorders in their head, and those who need care but don't fit the stereotypical embodiment are left out of receiving care altogether. And the eating disorder recovery community is also affected by the lack of representation. If you scroll on Instagram and go through the ED recovery hashtag, you'll see an enormous group of people seeking solidarity and support. However, most posts continued to feature thin, white, young women, and most of them were able-bodied. Further, they frequently featured stylized versions of food reflecting a certain class status, and being able to receive treatment is super costly, as well to be able to purchase specific foods deemed as safe foods and getting supplements are largely indicative of class status. Not many people can afford that. And the recovery community aims for unity and support, but it simultaneously reinforces eating disorder stereotypes because it brings a lack of diversity and ostracizes those who can't subscribe to the mold. If you look in the hashtag, those with the most likes on it are those who fit the mold of an eating disorder patient. Lastly, biopolitics and how media produces specific bodies affect eating disorders and the recovery process. Capitalist society continues to thrive under making people sick and insecure. We are bombarded with messages every day about how to look, the next diet craze, detox drinks, and weight loss wraps. A lot of the time, these messages are sent through social media like Instagram that is commonly used in the recovery community. However, at times the messages may be a bit more inconspicuous. On social media in general, there are tropes that actually coincide with eating disorder behaviors, but are under the guise of being healthy. If you look on Instagram, many times you'll see hashtags like hashtag clean eating or hashtag strong is the new skinny, which sounds like it promotes a positive body image, but it can trigger, reinforce, or mask eating disordered behavior. And some have gone as far as labeling these as fitspo or fitness inspiration. I follow a woman on Twitter and on Instagram. Her name is Melissa Fabello. She's a doctoral candidate who researches eating disorders and has proclaimed that fitspo is just thinspo in a sports bra, and that these hashtags often promote a specific way of life, eating certain foods and exercising excessively. And with these new ideas of having a positive or ideal body, it claims to be about health, when in reality it still subscribes to the idea that healthy looks a certain way and that there are good bodies and bad bodies based on your outward appearance and what you're able to do. And I don't think that's okay because it still promotes thin, able-bodied white women. And it's also more shaming than motivational because it creates the idea of good and bad food instead of enjoying all foods in moderation. And this culture on social media is also obsessive. It reinforces that fat bodies are bad, and one should feel guilty for deviating from clean eating or not going to the gym every day or having a cheat day. We also can't forget that going to the gym may not be accessible for poor people or people with disabilities, and therefore this automatically, in the grand scheme of things, makes them inferior to those who still subscribe to promoting this ideal body. And Melissa Fabello also stated that the public has started moving from valuing the protruding bones to valuing muscle tone, and the marketing follows that. It uses the same old shit repackaged to meet the new beauty ideal. And this shows that a capitalist society will continue to thrive over making people ill. They will continue to push a culture of diets and insecurity to ensure that they have money. And fat bodies are disposable and almost recyclable to them because diets don't usually work. Many people will gain the weight back not because of lack of willpower, but because of the restrictive methods that they've previously used by the diet companies. They know it doesn't work, but they want to keep you sick. They want to keep you feeling bad about yourself. And when people gain the weight back, they look for the next fix on social media, and will continue to help enforce that by promoting a certain ideal and certain ways to achieve it. As you can see, the facets of gender embodiment, perception, language, and intersectionality are all incredibly imperative when discussing eating disorders and its recovery. By not having a space for all individuals with these experiences to openly discuss how their identities affect their bodies, we cannot truly make any ground in eradicating this disease altogether.